You should check your breast at least once a month. Doing it while having a shower or in front of the mirror is a good routine. The best time to do it is a few days after your period ends, when your breasts will be less lumpy, they will be softer and not swollen or tender. Now, if you're a woman, you do not have regular periods, or you might be post-menstrual, then you might want to pick a day each month to examine your breasts, such as the first day of every month. And you want to press firmly with the pads of your fingers, not the tips, but the pads of your fingers. So you can start with any breast. You can move the right hand over your left breast in a circular motion, feeling with the pads of your fingers, making sure to check all over, including the armpit as well, because you can have lumps in the armpit as well. And then you want to move over and do the same for the left breast. The first step is also to know your breast. Know what changes are normal and what's not, because your breast changes when it comes to age, puberty, menstrual cycle, pregnancy, breastfeeding, and during the menopause. Now, if you're asking me, how do I know if my lump is cancer or non-cancerous? I can start by saying most non-cancerous lumps tend to be smooth, more mobile, and you might notice that they tend to occur just before your periods, while a cancerous lumps tends to be hard, fixed, and you might have an unusual shape or irregular shape of the lump. But a cancerous lump, as you can see from my 2 real-life stories, can also be big or small, hard or soft, painful or painless, just like a non-cancerous lump. So listen, I would not advise that on finding a lump, you try and self-diagnose yourself, because you're going to give yourself unnecessary anxiety. And we all have different perceptions of what's hard or fixed or mobile. I could tell you how many patients I've seen that will tell me that their lump is hard, and when I do feel the lump is actually quite soft to me, or they would say it's fixed, and when I feel the lump is actually mobile. But remember that having a lump does not necessarily mean that you've got cancer. 90% of breast lumps are actually benign, meaning that they're non-cancerous. But also remember that not all breast cancers present with lump or pain. So look out for other changes. As I mentioned, you need to be examining the breast, looking at the symmetry. Is one breast smaller than the other? Looking at the skin of the nipple. Is there any rash, such as eczema, or any changes to the areola around the nipple? Does the skin look puckered, like an orange appearance? Looking for any unusual discharge, bleeding from the nipple. As well as, it's also important to make sure that you always examine the armpit, looking for any lymph nodes or lumps in the armpit. And if you notice any unusual changes in your breast, you should be speaking to a doctor or a nurse. Now, I hope you found this video useful. Please drop some comments below, please share and like this video.